So, good afternoon, good evening, everyone. How are we doing today? Um, we are here again as part of our continuing series on survivorship issues of breast cancer. And today we talk about managing side effects of hormonal therapy for breast cancer. One of the reasons we chose this topic was, people talk about chemo side effects. They even talk a little bit about how to manage radiation, but a lot of women struggle with some of the side effects of hormonal therapy, but don't actually know who to talk to and how to go about discussing it. They're not even sure whether some of these issues relate to the hormonal therapy or if it's something else. So we thought that we would bring together a panel of people who would talk about this. But before we do that, quick reminder to people about what is Patients Engage. We are an online platform. We've been operational for over 5 years and focused on evidence-based and holistic management of chronic conditions from perspective of patients and family caregivers. As a lot of you would already be aware, we believe very strongly in the value of lived experiences and how being empowered and being informed about your condition leads to better quality of life. Uh, so as part of that, we've been also, especially in cancer, we also launched the Cancer Power Circle, which is a Facebook group. And we do regular discussions on various topics. I think this is the ninth since we launched the Cancer Power Circle in the last 5 months. And so we've talked about lymphedema, we've talked about bladder cancer, we've talked about how to talk to your children about your cancer. And as part of the breast cancer survivorship series, we talked about staying fit after breast cancer, which if you've missed it, you can check on our YouTube page. And we talked about body image after breast cancer as well. Um, Today we have with us a very interesting panel, and we're very privileged to have this panel with us. We've got Tulsi Chikhal, who is a breast cancer survivor, and some of you who follow our page would have seen that she, even climbed Everest Base Camp after her breast cancer. And we've got Mamta Goenka, who's been a long time supporter of patients and advocates for them. Was one of the first few to talk about lymphedema as well. So she became a lymphedema guru. She talked about how it's a dirty secret, and she's a 3-time breast cancer survivor. We have with us Dr. Vani Parmar from Tata Memorial. She's a breast cancer surgeon oncologist, and she is actually very articulate and speaks a lot on. And that's my dog in the background. Sorry about that. And we have our team of moderators, Shital, Urvi, and I am Aparna Mittal. I'm also the founder of Patients Engage. Quick, we also have our partners for this series, which is Karuna Care Foundation from Ahmedabad and Bliss Foundation from Delhi, both of whom have worked very closely with us on discussing the topics and also helping it reach a wider audience. A quick reminder to our attendees, this is this does not replace your medical consultation, even though we do have a doctor. Uh, the answers are reasonably generic, and you'll have to still, go to your doctor based on this. But you can ask your questions for sure, and you can ask them either in the Q&A box or you can ask them on Facebook under the feed, and we will address them during the session. The session is being recorded. And as always, if you have any experience to share or any questions, you can write to us at editor@patientsengage.com, and you can follow us on our website as well as our various social channels. Just a quick reminder, next in our series, we do have on 10th, which is next week, we're talking about cancer prevention and risk reduction. So we've got Dr. Gauravi Mishra, who focuses on preventive oncology. And we have Abha Khetarpal, who's a disability activist and very passionate about how women with disabilities are sometimes ignored in terms of how their treatment should happen, and how they struggle to even get screening done, and what are their options available, and so on. And then later in the month, we also talk about prostate cancer. We'll follow our page to know what date it is on, because this is Men's Health Month as well. So I think I'll quickly stop talking because we have a lot of ground to cover. So let's start. Thank you once again to our panelists for joining. Um, Dr. Vani, could you start by explaining when is hormone therapy advised for breast cancer patients and for how long?
First of all, thank you very much for having me on the panel, and it's an important topic that you've chosen to understand the side effects and um, toxicities of hormonal therapy in addition to its benefit. As far as breast cancer is concerned, the treatment of breast cancer is more now based on the biology of the breast cancer. So each patient is different, each breast cancer in every patient is different because there is a lot of permutation combination of receptors and biology that we talk about when we consider breast cancer treatment. And what is important is the treatment is not, it's a multimodality treatment. So not just chemotherapy, not just radiation, but sometimes some of the patients express, the tumors express certain receptors. And these receptors decide whether the tumor responds to hormonal treatment. In fact, interestingly, breast cancer is one cancer which has a lot of play with hormones, and they are responsible for causing the cancer as well as the anti hormones that we give them help us to cure the cancer. So that's how breast cancer really responds. Of course, uh, hormonal therapy is can be given at different time points. So some patients, rather let me put it this way, majority of them would be advised after the surgery to start based upon the expression of these receptors known as estrogen receptors and progesterone receptors. So their short terminology is ER and PR receptors, and I'm sure most of the breast cancer patients would have heard about ER and PR while their reports are being discussed. And these decide whether the tumor responds to hormones.
Mm,
The hormonal therapy can be given in the adjuvant, that means after surgery. Sometimes some of them receive it even before surgery. And there's
right.
a purpose for giving it before, because if their tumors are very responsive, slightly on the larger side and cannot be operated upon upfront, we can even start them before surgery, and that
Mm,
would help us to shrink the tumor down.
right.
So that's
Right.
what this is the commonest kind of hormonal therapy that you hear about.
Thank you. Thank you, Dr. Vani. Um, Mamta, let's start. Can you unmute yourself, Mamta? If you can quickly let people know about, the 3 times that you've had cancer, and did you need hormone therapy in each of them, or was it uh, in only some of them?
So I was first diagnosed in 1998. That was my first diagnosis. I had
Mm,
just turned 40, and was diagnosed with cancer to my right breast. In which case there was surgery that was followed by chemotherapy and radiotherapy. In this treatment, I did not receive hormonal therapy because my ERPR was negative. My second cancer came in the year 2001
mm,
to my left breast. And again, I went through the same protocol of surgery, radiotherapy, and chemotherapy. And again, there was no hormonal therapy, as again, my ERPR status was negative. Then cancer came knocking at my door one more time after 15 years in
mm,
2000, December 2016. And this came to my right breast again. And this time I went through mastectomy, followed by several sessions of chemotherapy, followed by hormonal therapy. So this time my ER/PR status was strongly positive. So my cancer was dependent on estrogen progesterone, and I was put on hormonal therapy. I've been on hormonal therapy for almost 3.5 years now. And the major side effect of my hormonal therapy that I have been facing is severe muscular aches and muscular aches and pains.
Right.
Not as much as my joints, but more of muscular aches and pains.
Hmm.
And uh, with the hormonal therapy, you are regularly given osteophos and calcium as supplements so that you don't get osteoporosis.
Right.
That's another side effect of hormonal therapy.
Right.
So for muscular aches and pains, I receive an injection every 6 months, which is zoloninic acid, I think, and that somewhat takes care of my aches and pains. And uh, obviously, we do some kind of home remedies as well. And um, what really helped me in terms of home remedy is drumstick soup.
Hmm.
That it is very high in calcium, and I tend to have it every single day, and that one thing has really helped me as a home remedy for my muscular aches and pains. In terms of any other side effects that I have been facing, just recently I've started to see some unwanted hair on my face.
Hmm.
And because of my skin color, they are not seen as much. Because if I pay attention in the mirror, only then I'm able to tell that there is unwanted growth. But if someone were to just the shelf look at me, they cannot tell that there is unwanted growth on my face, but there certainly is. And I'm going to pose this question to Dr. Vani later as to can anything be done, or I need to get my answer on that. So
Right. Right. Thanks, Mamta. Urvi, you want to quickly summarize
Yeah,
Hindi
yeah,
mein
yeah.
for our Hindi
uh,
audience? And just for people who are watching, I know we're receiving some questions on Facebook. You can continue to ask and we will take them up later. Thanks.
सो
Urvi.
ममता को यस 3 बार कैंसर हुआ 98 में बीच में और अभी 2016 में एंड 2 बार उनको हार्मोन थेरेपी नहीं लगी थी, तीसरी बार लगी जिसका मेन साइड इफेक्ट उनको जोड़ों का दर्द और मसल्स में पेन का रहा, जिसके लिए एक इंजेक्शन उनको प्रिस्क्राइब किया गया था जो थोड़ा बहुत उनको मदद किया वो पेन को रिलीज करने में। एंड एक और साइड इफेक्ट उन्होंने बताया वो ये है कि हेयर का ग्रोथ, बाल थोड़े दिखने लगे उनके चेहरे पे, जो विजिबल आपको नहीं लगेंगे अभी क्योंकि उनके स्किन का कलर उस हिसाब का है, बट उनको ऐसे लग रहा है और शायद डॉक्टर इसका जवाब देंगे कि उसके साथ कैसे डील किया जाए।
Hmm. और ड्रमस्टिक सूप फायदा
या
करता है।
जो या ड्रमस्टिक सूप जिसको हम वो सही जन के डंडी बोलते हैं, उसका सूप बना के पीने से ये जोड़ों का दर्द में राहत मिलती है, ऐसा उनका मानना है।
अच्छा, oh, it's called Saijan ki dandi. I didn't know that.
या
Okay,
या
thanks. Okay, thanks, Urvi. Um, Tulsi, Shital, you want to have the discussion with Tulsi first before we then ask Dr. Vani some of the questions that will keep
Sure,
popping
sure.
up.
Yeah. Hi, Tulsi. Tulsi, can you tell our audience a little bit about your journey with cancer?
So I was diagnosed with breast cancer in 2015.
Can you
Sep-
speak up a little bit? You're a bit faint.
So I was diagnosed with breast cancer in 2016 December. I felt this lump in the month of May in 2015, and this lump was in my right breast. I went and met a gynec, and she kind of diagnosed it, saying that it's probably a fibroadenoma and it's probably nothing, but I should still get a sonography done. I did get the sonography done in 2015 May, and it came benign. I mean, the result was benign. So I I left it. The doctor did say that I should probably just get some vitamin E tablets, and maybe this tumor, this growth that I had is going to the size is going to reduce, or it may grow, and if I'm uncomfortable with the size and I want to have it removed, I should just get it removed. When and if I want to have that done. Um, so in 2016 December, this growth had gone from whatever to 4 centimeters, and I was uncomfortable with the size, and that's when I went to the hospital, and um, I went and met another gynac who immediately asked me to kind of go and meet the oncologist. The and At that point she kind of gave us 23 odd tests that we needed to get done, and one of them was a sonography and one of them was a biopsy as well. Once again, the biopsy report, sorry, the sonography report was benign, and when the biopsy report came through, it did say that it was cancer. So in 2016 December, I knew that I had this cancer in my right breast, and yeah, and post which I went through 12 rounds of chemotherapy. I also had a mastectomy because the size of the tumor was pretty large, and I was given two options: either to have a lumpectomy and go through radiation, or avoid radiation and just get a mastectomy instead. So I chose to get a mastectomy. I also went through getting a reconstruction done, and I was lucky because my cousin, who was in Italy at the time, also was going through a similar, cancer. And she told me something about a nipple sparing mastectomy, which at the time I was not aware. Like, I did, of course, Google to see, what the options would be and all of that, but I didn't see too much about a nipple sparing mastectomy. So I was really lucky because if you look at my breast now, you will actually look. It just seems like a whole complete breast. It doesn't. I mean, barring a few scars and things. Apart from that, it looks like a normal breast. Of course, I don't have any sensation on my breast, and they use the muscle from my back, which is the LD flap, to reconstruct my breast. So,
And
and I
you're
was
currently on hormonal
yeah.
treatment,
So
right? Yeah.
I was ER/PR positive, and I started with hormone treatment in 2016 December itself. Right after my operation, the surgery. Right after that, I went. I mean, I got my first shot of Zoladex, and then I went into chemotherapy in Jan of 2017. And in 2017, for the first 3 months, there was, the doctor said, maybe you won't need to go through, hormone therapy at the time. And once chemo is over, maybe we'll start you again on it. But yes, I did get my period in the month of March. So they started me off on the injections immediately.
And what are some of the side effects that you've had with this?
So the side effects, as Mamta rightly pointed out, yes, there's definitely lots of unwanted hair. Uh, yeah, I mean, I have it on my beard. I have it, yeah, it's just all over. Right on my face, sometimes feel like a man. I have a lot of hair growth. Um, there's definitely vaginal dryness, which happened in the initial stages, and that is very, very. I mean, it's very uncomfortable. There is definitely muscle pain. There is definitely waking up and feeling like an old woman. And it used to take me about half an hour to just step out of my bed. It was that bad in the initial days. It was really, really bad. Like, I would wake up, lie in my bed, and hope that maybe I can now take my first step. So yes, that is one of the other side effects. And the other one, which I'm still battling, is mental health. In terms of, I get very, very angry and very, very quickly, and that is something that we need to kind of understand better. I don't know whether it's a side effect only of hormone treatment, but yes, it's definitely something that has happened after the treatment has begun. Um, so I mean, it could be something as small as something really small, and that just flare up, which is very unlike me. But yes, that is something that does happen. And every time I take the Zoladex, there is bone pain, there is feeling old, which constantly happens. Yes.
You also had hot flashes, right? Tell us about that.
That's the
Yeah.
most important one. I'm sorry to miss that out. I had severe hot flashes. In fact, I just when we started the Zoom call, I did have one round of that. You know,
Oh
if
no.
and when I do have it, I will definitely interrupt and say, "Hey guys, look at me now." But yeah, so I have had severe hot flashes, where I would have about 15 to 20 hot flashes in a single day. And yes, my doctor did say that it was severe. I would be completely drenched down to like whatever I was wearing. Wearing makeup, wearing nice clothes is something that I don't do anymore. Dressing up is something that I don't do anymore because I'm sweating all the time. Even when I did my Everest base camp trek where it was minus 23 degrees, I did get my hot flashes and I was quickly taking off my jackets because it was suddenly so hot, and then having to wear them back on, or put everything back on again so that you don't catch a chill. um, so yes, I have battled hot flashes for a long time, and the one thing that has helped me with hot flashes is using a little bottle which has peppermint oil in it and a little bit of water. And whenever I would get this hot flash, I would just spray it on my face and the back of my neck, and that's something that has kind of helped me calm the nerve and also feel cooler faster.
And anything that helped with the vaginal dryness that you mentioned, or did you speak
Yes.
to your
So
gynae or anybody else about?
I did I just use coconut oil as a lubricant, and that's something that did really help me, because it was very painful in the initial days. It was very, very uncomfortable. Even walking was a problem, and I did also have a lot of boils. I still remember there was one time when I had about 11 boils, in the area, and it was very, very painful. So yes, coconut oil is something that I did use to kind of as just as a lubricant. So
But
Right.
was there anybody you kind of talked to about,
no, I didn't.
these symptoms?
I didn't because coconut oil kind of worked for me, and I was happy with that. So no, I didn't talk to anybody about it.
Right.
Sorry,
Okay.
this is
So
the follow up to the dryness. Did you have any sort of bladder issues, or the dryness itself can lead to, in some people, it can lead to a lot of infections, UTIs, etc.
No, I had
Any
no.
of those?
I had none of those. The only thing I did have is, yes, like I mentioned, I had 11 boils at one point, and that was very painful.
And you were recommended to get your ovaries removed,
Yes,
right?
yes.
Uh, at what point was this, and do you know why?
So this was also when I complained of severe hot flashes, and I was just told that it's better to have the ovaries removed rather than constantly going for a Zoladex. Going for Zoladex every 3 months. And they said that it's better to have the ovaries removed, but that's just me. I chose to not have them removed. That's just a choice that I made. You know.
Urvi,
um,
do you want to
that's a lot to summarize. So a few key points,
summarize
Urvi.
that? Sorry, I know that was
Yeah.
a lot.
सो आई मैं वहीं से स्टार्ट करूंगी हार्मोनल थेरेपीज की उनको जो साइड इफेक्ट्स हुई उसके
Hmm.
बारे में मेन उनका जो साइड इफेक्ट था दैट वाज हॉट फ्लैशेस जिसमें बहुत पसीना अचानक से ही बहुत पसीना आ जाता है वो उनको बहुत ज़्यादा सीवियर इसमें हो रहा था जैसे एकदम से ही पूरे कपड़े मेकअप एवरी सब चीज़ें एकदम गीली हो जाती थी इसमें उनको पुदीने का तेल जो पेपरमिंट ऑयल बोलते हैं उसका स्प्रे फेस पे और गर्दन के पीछे स्प्रे करने से उनको काफ़ी राहत मिली इसमें दूसरा तो जो ममता ने बोला वही था जोड़ों का और मसल्स में हड्डियों में दर्द और यहाँ तक कि उनको सुबह उठते टाइम ऐसे बहुत एज हो गई है बहुत उम्र की हो गई है वैसा फील हो उतना ज़्यादा पेन हो रहा था. And third side effect, one more she said was
You said hot flashes, vaginal dryness.
वजाइनल ड्राइनेस या
Hmm.
वजाइनल ड्राइनेस का भी उनको बहुत इशू था, जिसमें आपके प्राइवेट पार्ट्स में पार्ट ड्राई हो जाता है और वहाँ छाले उनको यहाँ तक खराब हो गया था कि छाले आ गए थे वहाँ पे और चलने में भी मुश्किल हो रही थी। उसमें उनको खोबरे के तेल ने बहुत मदद किया। खोबरे का तेल, कोकोनट ऑयल वो वहाँ लगाते थे, जिससे वो स्मूथ हो गया और उनको काफ़ी राहत मिली इससे।
Thank you. Thank you, Urvi. Dr. Vani, I think we've covered fair number of kind of side effects, but are there still others that we've missed, or would you like to quickly summarize for listeners?
Well, listening to both Mamta and Tulsi makes it sound as if the hormonal treatment is really terrible. In fact, I would say that they have highlighted the really distressing kind of side effects that do come up with hormonal therapy. But let me come back to the fact that it's not that everybody experiences every one of these, and neither do they experience it to the level that each one of them have actually expressed. Of course, there are some who really go through a bad patch.
Right.
So let me start from there. And I think they have really listed out both. So let me take each of them because they are talking about two different hormonal treatments. And it's very important to understand. Um, so what Tulsi has gone through is basically a side effect of a tablet called tamoxifen,
Right.
as well as if you do an ovarian suppression. So Zoladex injection that she talked about is something that's given to suppress the effect of functioning of the ovaries.
Okay.
And these are two things which are advised for younger women who are still menstruate.
Right.
And they are the ones who would get tamoxifen, and suppressing ovaries are known to be a benefit as treatment for cancer. So obviously, whatever is being given is because there is a benefit, and the benefit is quite significant, not just in preventing cancer coming back, it also helps to protect the opposite breast from getting a new cancer. So that is why it's very important to take these drugs in spite of their side effects.
Okay.
But as we are discussing here, the side effects. So obviously, we must understand that if the treatment is given, we also learn to accept them and somehow learn to live with these side effects. And probably as we adjust and acclimatize, these become minority compared to the fact that you're disease free and cancer free for quite some time. So tamoxifen primarily causes the symptoms that have been described. They can also be thinning of hair or hair loss, which has not been mentioned, as well as, of course, hot flashes, which are very distressing when they come in. But let me tell you this, if there is a normal menopause that happens, women go through hot flashes too,
Correct.
without the hormonal treatment. We don't talk about it because that's such a natural phenomenon, it's physiological, and we know that you've not taken anything exogenous or not taken something that caused it, so we don't talk so much about it. We accept it and as a normal phase of menstruation stopping and becoming postmenopausal. Obviously, it causes little decrease in the sexual libido as well as dryness of vagina, which has been talked about. So all these side effects now you can understand is because we have created a menopause in women
Right.
by giving them injections to stop the Zoladex is an injection. It's given to stop the menstruation.
Right.
Tamoxifen at the same time adds to it. It's an anti-estrogen. So it
Right.
adds to these side effects. And that's the reason why they're kind of slightly amplified and it comes on so suddenly.
Right.
And felt more so because women who have been having normal menstruation, they have a sudden cutoff.
Right.
And this is so sudden that the body does not have time to acclimatize. And that's why you experience much more severe symptoms. And as time goes, say 3 months, 6 months, a year and a half, they start reducing as they would in a physiological menopause.
Right.
So it's that period that one needs to learn to tide over, and that's where it helps. And as far as Mamta is concerned, what she went through is because the hormonal treatment given to her is what's given for those who have stopped menstruating or who are menopause.
Mm,
In them, the tablet given is aromatase inhibitor. It's a different drug, acts in a different manner, and of course, does cause some amount of the androgen kind of an effect of having the hair growth on the chin.
mm,
And of course, and the second important thing is it causes bone pains,
right,
muscular pains and bone pains.
right.
And that is why an additional supplement of calcium helps, as well as tablets, which increase the bone health or improve the bone health. And that's what is added to them, and the doctor usually advises these tablets as a package along with calcium and something to improve the bone health.
Right.
Important thing to note is that because it reduces the bone strength if the supplements are not taken, or if the side effect of bone depletion is so bad, it
Mm,
can cause fractures.
right.
So that is where one has to be very careful. And too much of bone pains requires some tests to be done called as the bone mineral density scans, which tells us if the bone has weakened so badly that it might fracture, in which case we need to change the drug or stop the drug.
Right. Okay.
So these are the two things that they had probably, I mean, they are the extreme ones. I thought it would be important to mention
Sure.
them in addition to what they felt, yes.
So what you're saying is that, and in a sense, we've kind of got two panelists which cover both uh, kind of age groups as well, right? So um, Tulsi's symptoms are kind of reasonably common among younger women who go through breast cancer and hormone therapy, and Mamta's are typical of women who've stopped menstruating and okay. Um, are there, I mean, apart from ways that they've all worked out and what you suggested, but are there other ways of minimizing these effects?
There are, because if you see, now I'll take each one. So the younger women who take tamoxifen and require to have ovarian suppression, not everybody gets ovarian suppression.
Mm,
Some of them get only tamoxifen. In them, these hot flashes actually get worsened if you have, say, coffee, excessive coffee, caffeine. They
right,
can cause it can cause an exaggeration of symptoms. Um, Sometimes it's just an exposure to temperatures also can cause this sudden surge of, uh, the hot flashes coming up. So these are things which are kind of they make it worse.
right,
And maintaining a good hydration is always good. It reduces some of the symptoms, but majority of them are that spontaneous, and they, as I said, they're transient. They're a phase that goes through and then it settles down.
okay,
Yeah, as far as the aromatase inhibitors are concerned, those symptoms are not really stimulated by any kind of physiological thing. They are known side effects, and I guess supplements is the best way of avoiding and preventing
right. And I guess does to this question to you, Mamta, does it also help in reducing muscle pain and by kind of exercising regularly or doing yoga? Do you find that has worked for you?
It definitely has. Yoga has definitely helped me reduce my muscular aches and pains. I regularly do yoga 5 days a week at least,
Mm,
and some amount of walking. So
mm,
initially, yes, as Tulsi said, it's very difficult to take that first step out of bed because your aches and pains are so bad. But once you're out of the bed, you can always. I walk for like half an hour in the morning and do yoga in the evening for an hour. So doing some amount of physical activity, putting your side effects on the side and moving on, really, really helps.
right,
that.
right.
So if I can also add there,
Sure.
in fact, if you just take a normal menopause and the
Correct.
osteoarthritic symptoms that come up, it's inactivity which worsens the pain and stiffness. And
Yeah.
most women will feel these right in the morning when you wake up. You find stiffness of the shoulder, of the joints, of your hands, and you're kind of wondering how the hell am I going to get through the day. And the minute you start moving around, you tend to forget this pain because you start becoming more flexible. So it's that flexibility that comes in that actually takes away this whole pain and symptoms. So in all cases, physical fitness, walking, and sticking to a routine exercise plan is very, very good for avoiding all these aches and pains, and they do help in reducing these aches and pains a lot.
Right. Urvi, you want to throw in a call out to swimming as well? 'Cause-
Yeah, yeah. Swimming has helped me a lot. Yes, I always feel that it has helped me in like reducing the joint pains. I had this joint pains in the small joint pains, and yeah, but with time also it went away. And my doctor had also told me the same thing, that it may go for some 8-10 months, and yeah, actually it went away.
right. Um, so since we're talking of menopause, right, just for that, so that people who are listening can be clear, because sometimes some of them say they went through forced menopause, or some people use the term induced menopause. So can you explain that, and is that temporary or permanent? Because some people even say that my periods came back, and so on. So if you can explain those terminologies, as well as whether they are temporary or permanent.
So as I said, younger women who are menstruating would be advised tamoxifen.
Mm,
So tamoxifen is an anti-estrogen. And what it does is it also works on the uterus as well as and on the whole system. And there is irregularity in periods that set in because of tamoxifen.
right.
Of course, most of these women would have received chemo as well.
Mm,
So keeping that in mind, it's very rare that in the younger women you give only tamoxifen.
mm,
Chemotherapy would have suppressed the ovaries as it is and would have started off an induced menopause, because
mm,
what it does, it stops the functioning of the ovary. And because the ovarian function has stopped, it's a menopause that has been created. So there is already symptoms of all these symptoms of menopause that set in. What tamoxifen does, it's an interesting drug because it has two effects. It has an estrogenic effect and an anti-estrogenic effect. This is to confuse everybody now.
mm,
So, because of this, certain organs in the body have the estrogenic effect of tamoxifen, and certain organs have the anti-estrogenic effect. What cancer gets is the anti-estrogenic. But in this whole, estrogenic, anti-estrogenic milieu that's created, the periods do stop. In fact, in some women, it becomes irregular, some it completely stops.
mm,
Very rarely, there can be an excess periods as well. Any of these three. But the most common is the periods do stop. One important thing that I must bring out is periods stop, but they don't make her immune to getting pregnant. And pregnancy, in all situations, while tamoxifen is going on, should not be there because tamoxifen is harmful to the fetus and the baby.
mm,
So, this temporary stopping of periods is not really a menopause. It's just that periods don't happen because the hormonal levels have come down to a level that there is no period happening. That also means that somewhere down, after a period, say about 3 years or 4 years or 5 years, periods may restart, even
mm,
though tamoxifen is ongoing. So younger the woman is, say 35, 38, 40, there is higher chance that they may regain the periods, say after 4, 5 years. Very irregular, scanty, yes, may not be a regular one, but that also indicates that they remain premenopausal. They
right.
don't become menopausal,
Right.
even though the periods are not happening. So that's one important thing to remember. And as I've said, pregnancy and this time period can happen because they get this false sense of feeling that, look, I'm not having periods, I will probably not conceive. But
Mm,
that's not so. And a conception while on tamoxifen is not really good.
right. Right. Okay. I'm going to take a couple of questions that have come on Facebook. There is one which says, I'm a breast cancer survivor, taken tamoxifen 5 years now, stopped taking it last 1 year. I'm suffering from lung sarcoidosis. I'm on steroid. Is it safe to take?
All right. So that would be lung sarcoidosis.
Okay.
It's a condition.
Mm,
Which requires treatment with steroids.
right.
And there is no interaction with steroids per se and tamoxifen. Yes, but tamoxifen has been stopped after 5 years. Of course, currently the treatment with tamoxifen is not stopped at 5. We continue for a longer time period because of evidence of benefit even beyond 5 years. But it's possible her doctor had discontinued it, maybe because she also developed lung sarcoidosis requiring some more intensive treatment. There is no direct interaction between steroids and tamoxifen per se as known. But I guess now that she has discontinued, it will be watch for symptoms if at all and a restart of treatment if required.
Right. Okay. One more question, not on hormone therapy, but does one get, not on hormone therapy currently, does one get dark patches in areas where radiation could have left an imprint? Her radiation was in 1998. Hormone therapy stopped in 2004, restarted 3 years back due to thyroid issues. Skin has got itchy now. Is that related to the
Not really,
hormone? Not
not
really.
really, not related at all. I would say it's more related to probably some skin irritation, maybe, which is causing mild inflammation in the skin and pigmentation, not related at all to hormonal therapy being started or being continued, or any such.
But could the pigmentation be because of radiation therapy?
The post-radiation pigmentation doesn't last for too long. It usually starts clearing up after a while. In some patients, there can be a kind of prominence of blood vessels, a little streaks of red that you see in that area. But the
Right,
pigmentation itself does not stay on for so long. It
right,
goes. It's
right.
more a early uh, uh, kind of a side effect of radiation.
Okay. Sorry. Shital, Urvi, if you have any other questions as I'm scanning through the questions on the page.
Dr. Vani, can you explain fertility advice that you give to all your breast cancer patients, please?
So in fact, hormonal therapy is so varied. We kept on talking about tablets being given, right? We talked about tamoxifen being given or aromatase inhibitors, the various kinds of it. I don't want to be going into details. There are other issues that come up because um, suppressing the ovarian function, that's the Zoladex that we heard Tulsi talk about, is another aspect which is done as a part of treatment. But interestingly, it was found that women who were not ERPR positive or hormone responsive, when they were advised the use of Zoladex along, when chemotherapy was being started, it suppressed the ovaries and made them quiet. Now, because they made them quiet, the chemotherapy didn't really harm the ovaries or suppress the ovarian function to that level, though the Zoladex itself had already quietened the ovaries down. And when we actually finish chemotherapy and we stop Zoladex, the ovary comes back to its normal function. So the important side effect of chemotherapy on ovaries is because it stops the ovarian function, the possibility of conceiving is reduced. And this is very important because you understand that young women, generally 30, 34, 35, and today's time, they probably would have got married but wouldn't have had a child because they're focusing on profession, wanting to work. So they are kind of postponing getting a baby for some time. And unfortunately, when cancer comes in at this point of time, it's a tough fight. It's a tough decision. It's a tough situation to accept. And that's when you realize that one needs a chemotherapy, but the chemotherapy can make her infertile because it suppresses and damages the ovaries to the level because they're fast multiplying cells in the ovary, and that's where chemotherapy just targets these cells. So the chance for conceiving goes down. So infertility can be secondary infertility because of chemotherapy. So to protect the fertility, sometimes a Zoladex, which is actually a kind of hormonal treatment, it's a medical ovarian suppression, is done to actually protect the ovaries and protect the fertility of the woman. So that's an important way of using the hormonal treatment. So hormonal treatment is not just tablets, can be surgery, removal of ovaries as well.
Mm.
We don't advise this in young women because we do need to maintain the fertility and ability to conceive. And in women who are already menopausal, doing anything to the ovary in the form of medical ovarian suppression or surgery does not work because the ovary has physiologically stopped working. So there the modality of treatment changes.
And do you also advise fertility preservation for?
Yes, so this is a counseling that happened, but every woman has to understand that fertility preservation is not something that's straightforward, preserving the ovum, preserving the egg, or preserving the fertilized egg. So any of these, what oocyte, is not really 100% success, but it's probably the only chance for some of them to conceive. But there are a lot of nuances that one must weigh in balance. Because if any of, anybody has ever read about it or have gone through it themselves, harvesting and, ovum is actually a process which requires stimulating the ovary to produce one. The process of stimulation actually ends up stimulating even the cancer,
Mm.
which is hormone sensitive. So we do not advise for repeated stimulation, maybe one attempt before chemotherapy is started to try and harvest the ovum and fertilize it and then freeze it is probably a better choice, but would not suggest that this be repeated too many times or tried too many times. In any other circumstances, probably 6 cycles would be tried, 6 times. You may get a stimulation and try and harvest. Such a thing in a breast cancer patient is absolutely not advised. But fertility preservation is an important thing, and one easy way of doing that is, of course, using ovarian suppression by injections or medical ovarian suppression, where the functioning of the ovaries is protected by using these from chemotherapy.
Right. Urvi, you were saying something.
Yeah, I was seeing one common side effect which patients come with is weight gain.
Mm.
So, yeah, any dietary changes or anything you suggest to arrest the weight gain?
So weight gain is important side effect of these tablets, and it is there with both tamoxifen as well as aromatase inhibitors. But interestingly, tamoxifen reduces the bad cholesterol. So let's talk about the side effects wise. It has an impact of reducing the LDL, which is the bad cholesterol, and hence it can be actually protective to heart disease as well. But weight gain is a side effect that's been observed both with tamoxifen as well as with aromatase inhibitors. There is also an alteration in lipid profile even with the aromatase, which are given for menopause, post-menopausal patients. Even they cause alterations in the cholesterol profile. But weight gain per se can happen in both of them. And physical exercise is the best way of controlling both because the more the body fat, more is the chance that you will fail on your treatment. So why am I saying that? Because as an induced menopause happens, there is this peripheral aromatization. What it means is the body fat gets converted to estrogen, even though the ovary is not producing estrogen. So the peripheral body fat goes through a process in the body where that becomes the source of estrogen to stimulate the cancer cell to grow. Hence, reducing body fat is very, very important to prevent recurrences or to control a disease, especially after menopause.
Okay. I think also since when you talk of normal menopause, right, there is the hormone replacement therapy that gets talked about. Is hormone therapy for cancer different from hormone replacement therapy for kind of normal menopause?
Very much, very, very much. And it's very good that you brought this up because it's a nomenclature which I think somebody who doesn't know would use it so loosely and would not understand because, yeah, you're getting a hormone treatment, right? So I'm getting replaced because I don't have it.
Hmm.
Actually, the hormone replacement therapy is a completely different perspective because there you're trying to replace what the body does not produce.
Correct.
So the common thought process is that when the ovary stops working, because you get depleted of estrogens and progesterone in the body, which is the normal uh, hormones which keep our menstrual cycles normal and so-called young, energetic women and ladies are because they have, a normal ovary functioning. So the advice for gynecologists is that if the ovary has stopped working because you had a surgical removal of ovary or you're for a natural menopause, replacing these ovaries will keep you young and agile for
Hmm.
a longer time. Unfortunately, evidence is there that hormone replacement therapy can actually cause increase the risk of breast cancer by as much as a 1.64 folds. That means 64% increase. The hazard ratio is 64% increase. So one would not like to get into that situation of, especially so there is a already a pre-existing risk. Now, when I put a pre-existing risk, it could be anything from having a familial risk to being, say, overweight and obese. Any of these, it's just not right that you add a hormone replacement therapy and increase it further.
Right.
So it just not only causes increases risk in breast cancer, but there are other cancers as well. So I would not get into those, but yes, hormone replacement therapy does that. What
Right.
is it different? The hormone therapy given for breast cancer treatment is actually an anti-hormone therapy. We don't use the term anti-hormone because you're doing anti-estrogen and you're doing anti-progesterone.
Hmm.
But then there is also a progesterogenic treatment. That means something that is similar to a progesterone but slightly different in its molecular structure, which is given. So these are also progestins, they're called, are also given for treatment of breast cancer. So there are two different drugs, two different purposes, two different actions.
Right. Right. Okay. Mamta, you had said you have question for
I think Dr.
Dr.
Vani had already addressed about unwanted hair, and
Okay.
that's part and parcel of your hormonal treatment. And um, like I always say that how we develop coping skills to cope up with the disease, we also need to develop coping skills to cope up with the side effects that come with the drugs that follow our treatment, right? So basically it's just that you learn to live with that, it becomes part of life.
Correct. Correct.
True,
And
true.
I think my own, our own experience is that even kind of normal menopausal women go through increase in unwanted hair, the uh, unwanted facial hair. So there are other parts
Yeah.
of the body where hair thins actually, but facial hair does go up
So
even
there
in.
is a terminology that's used for this kind of a side effect. It's called hirsutism,
Correct.
where there's an actual increase in the androgenic hair distribution and reduction in the rest of the hair. So
Right.
thinning of hair on top of the head is a very common thing, and people. That's the reason why hormone replacement therapy was supposed to correct all of these,
Mm.
and that's where the whole problems actually start.
Right. Right. Okay. So I think we've pretty much, I'm just doing a quick scan of any other questions. So there are a couple of very specific questions. Uh, Dr. Vani, there's somebody who said that they used to come to Tata, they're in Delhi, but can't come now. They can connect online, right? Now?
Yes, absolutely. We have started a tele and video consult facility as well, which makes it easier for any of the patients who cannot travel now with the COVID pandemic, which is still going on. In fact, though it's now hopefully reducing, but travel had become difficult, and there's always a risk that, and the fear that one would acquire COVID during travel. But there is for routine checkups, etc., just a routine follow-up, teleconsult, video consults. We can even help you out in getting a consult in your local place and discuss with the doctors also. So it's not really difficult. So it's not something that to worry about that you can't travel to us. Yes, we can help you out in other ways. And
Right.
it
So the
can be
best
done
is to
on
go
the
to
best.
the website of Tata
Absolutely.
Memorial. Right.
Yes. So
Right.
go onto the website. That's tmc.gov.in and check out the facility there. You will get the link and you can ask, request for a teleconsult or a video consult, and you will have one of the doctors connecting you. In fact, we do uh, every day of the week for a few hours. We connect with patients and we talk to them. If
Great.
not, we can even get emails, and emails can also be responded.
Okay. Okay. Is there a standard email that, or the best is to go through the
I
website?
think the best is to go through the website because some patients do tend to find your emails up some or the other, manage to send you a mail, but it still goes back to the same department. There is a department which handles this now officially, makes it much more easier and streamlined, and it gets into your system because we get all the data up on the uh,
System.
on the system itself and easy to retrieve when somebody else looks at it as well. So
Right.
it's always best to go through the website.
Great. Thank you. Thank you. Um, Tulsi, any final? I think I'm just aware that we are kind of at the hour mark. Are there any questions that we've missed, Shital, Urvi, before we get into the closing?
No, I think we didn't touch a lot upon mental health symptoms,
Ah, yes, good
but
point.
Tulsi did mention irritability and anger, right, Tulsi? Dr. Vani, anything else that you can
Yeah.
advise patients on depression or mood swings and things like
Yeah,
that?
so the mood swings definitely are a side effect that's been observed, and I think it varies from individual to individual. There is, as I said, it's basically understanding that these are all a result of your treatment, and it can affect an interpersonal relationship as well. So I guess it's not just the patient who has to change or accept these kind of behavioral changes. It's also the caregivers and the family and the surroundings, the people who are interacting on a daily basis. They can help a lot in in helping them to cope with these mood swings because these are not something which is in their own control. Secondly, of course, getting into things like anything that calms you down, meditation, it could be music, it could be a physical exercise, or get on with some kind of a hobby that keeps you busy. Anything that has always been in the back of your mind that you want to do it today because then you'll find that it actually calms you down completely. Everyone has their own methods. Somebody talked about swimming, someone talks about painting, it could be a music, it could be just interacting with people. You don't know what is it that really calms you down, and if you can find your own interest and what really helps you, I guess that's the best way of controlling your mood swings. And it happens, the irritability is much more if you can't uh, get what you really want to do, and I think that's where you just have to find your own solution to it. But yes, meditation and yoga has always been known to help in these mood swings.
Right. Tulsi, what have you figured as your solutions, or what has your family figured as the solutions?
So I love to cook. It's something that really, really helps me, and right through the lockdown, I think I've really enjoyed just being in the kitchen and cooking up different dishes. That's something that I've really, truly enjoyed. It's just that I need my own space and I can't have anybody else in the kitchen at the time. So I've definitely, that's something that's worked for me. Swimming is something that I did extensively, right after the chemotherapy and when I was allowed. Um, and yes, I did do a little bit of painting as well, which is, like I would just sit for 4 or 5 hours. The day would just go by and the sun would go down and I'd still be at my desk painting away. So yes, that's something that's definitely helped. And yes, both Dr. Vani and Mamta also mentioned about exercise. And something that's worked for me personally is because I was training for Everest Base Camp, I would take 30 floors, 60 floors in a day. I would just climb the stairs. And that's something that, again, would just help me so much because I'd wake up feeling fresh the next morning. Yes, of course, there would be, bone pain, and Urvi mentioned, joint pain, where I forgot to mention this, that it was difficult for me to even do this in the morning, and I think over time, you learn to accept it, and it's always mind over matter. I keep saying that to people, that it's always, always, always mind over matter. And once you overcome that, and once you learn to say, okay, you know what, God has dealt these cards to me. Now I'm going to play the best game that I can. And once you start looking at life like that, life just changes for you. You become, like I mentioned earlier, you become your 2.0 version of your old self. So when people talk about the new you after cancer, i don't like I don't like to hear that. I don't like to hear that you need to accept the new you. I want to and I've chosen to be a 2.0 version of my old self. So that is something that I personally believe, that don't limit yourself. After cancer, before cancer, eventually we're all going to die. So whatever you want to do it now, because this is, you've got only one life, and this is it. So do it now.
Fantastic. Tulsi, I should say that, I admire the fact that you actually did a base camp and you trekked it up.
Yeah.
So I have something to add to that, because I drove to the base camp on the north side and
Oh,
did that because that was something that I just wanted to do in my life, irrespective. So I've enjoyed every bit of it. And I think everyone has to set a goal for themselves,
yeah.
and you have to achieve it. There's nobody else who's going to do it for you. And if you're able to actually do this and put all your passion into it, like what you've done, and it's brilliant. It's brilliant what you've done, and I think that's a lesson for everybody who's going through it. Because remember, God has just given you a test, and you have to pass.
Yeah.
And that's up to you on how you go ahead and you pass the test. And I think that's very important.
So I'd like to add here, that the reason why I chose to do the Everest Base Camp was not entirely for myself. It was more also, when I would go to the hospitals and I would interact with people, they would be like, no. And the blogs that you would read, people would just talk about this new you and acceptance, and say that, oh, abhi to cancer ho gaya hai. Now you set yourself boundaries, you set yourself limits, and I wanted to change that. I'm not somebody who's a trekker. This is the first trek I've done. It took us 12 days to get to the base camp of Mount Everest. But I chose to do that because, when you think Everest, you think the tallest mountain in the world, right? And you understand how tough it would be to do that, right? And that's the reason why I chose Everest, because I wanted to get the message out that don't limit yourself. Accept the fact that this has happened to you. And after chemotherapy and after going through treatment and all of that, it wasn't easy. Let me tell you, it was not easy at all. I mean, there were days when I would, I screamed and shouted at my husband, who was bichara, was with me as well. And I said, why? I didn't have any sense. Didn't you have any sense to kind of, stop me from doing this? But because I felt this was harder than going through chemotherapy. It was so hard. It was so hard. But the one thing that kept me going every day was, at the end of every day, I would be allowed, I had allowed myself one Snickers chocolate, which I was otherwise not allowing myself. But yeah, I mean, it was very, very hard. But you choose to do this not only for yourself, but also for others who are following your story. Because if somebody's following my story, and if somebody hears about it and talks about it to 5 other people, it just changes the perspective. And that's what I wanted to change. I didn't want people to be scared of the word cancer. The moment you hear the word cancer, you think, that's it, my life has ended, I'm going to die. But we need to change that. We need to change that. So there is life beyond, and it's a beautiful life even after that. So
True.
accept it and live on.
Thanks, Tulsi. Mamta, your final piece of
So
advice.
my final thing is, I think that cancer has been a boon to me. And when we were talking about side effects, I think that every side effect that I have, I can blame it either on my hormonal therapy, or if I forget something, I said, hey, you know what, I have chemo brain. So every which way, it's a win-win situation. And um, so why I say that cancer has been a boon to me is because I always wanted to work with patients in my life. I always wanted to be in a hospital setup. I wanted to be a doctor in my life, but I hail from a very typical Orthodox Marwadi family where I was not allowed to be a doctor. And God brought my life full circle. You know, He gave me cancer, and He gave me the will. He gave me um, such beautiful people in my life from Tata Memorial Hospital. They believed in me. They gave me the liberty to come and do what I really wanted to do. So it has really, really been a special boon in my life. And I thank God for giving me cancer. And as Tulsi said, there is life beyond cancer. I completely agree with that. There is a beautiful life beyond cancer. And when your diagnosis comes in, I think we all need to understand that it is a diagnosis. It is not a death sentence. You know, the minute diagnosis comes in, we take it as a death sentence. It is not a death sentence. It is your diagnosis. As long as Dr. Vani tells me, Mamta, this is your diagnosis and this is the treatment, I'm okay with that. Right? If someday she says, Mamta, this is your diagnosis and I do not have treatment for it, then I may have a problem. But as long as there is a diagnosis attached with a treatment to it, I'm good with that.
Right. Thank you. So I think good point you make that, cancer is a diagnosis. It's not a death sentence. I still remember when we started Patients Engage and we said we focus on chronic conditions. So many people said, but then why are you doing cancer? Right. And I said that people live after cancer. It's not as though, there is no life. So that's one of the reasons we continue to focus on survivorship issues in a large way, because it's people are living after cancer and they live for many years, right? So we have 25-year survivors, 30-year survivors now. So I think it's
Aparna, one more thing I'd like to add, that we are so fragile. From one breath to the other, we do not know. We are so fragile. We should always have a fragile tag on us,
mm,
right? So if I take a breath and and I inhale and I exhale, I don't know whether I will be inhaling again or not. So we're so fragile. So every one of us are so fragile that why do we then have to fear cancer? Right?
right.
That's my take on this. That life is
Yeah,
just so fragile.
correct, absolutely. Okay. Any final myths or anything that Dr. Vani you want to tell the listeners?
Well, I guess most of it has been very beautifully expressed by both Tulsi as well as Mamta, and I have nothing much more to add, except that I'll just say this: cancer is something that just helps you to move on to a new page, a new chapter, a new life, and treatments. Remember the benefits, accept the side effects. That's all I would say. I mean, there is nothing much more that I can add to this.
Good. All right. Thanks everyone. Any final points, Urvi?
I guess we've covered everything.
Okay. All right. Thank you all for taking the time. And we've had a lot of people watching and asking questions as well. And we will put this up on YouTube as well, so that more and more people can continue to watch it. I think it's a very useful session that we've had. And as always, it's important for people to know that there is life after cancer. There is, yes, there are side effects, and we talk about them because it's important that people understand that they're not alone in dealing with it, and they can learn from each other's experiences. But they can be managed, and some of them will reduce over time, some will increase over time. Each of us is different. But I think, and thank you, each one of you, Tulsi, Mamta, Dr. Vani, and
Thank you.
as always, Urvi and Shital, for being co-conspirators on this. Thank you.
Thank you very much. That
Thank
was
you
a
so much.
very beautiful conversation. Thank you very much.
Thank you.
Thank you.
Bye.